This is an interview on behalf of men who live with a condition like sclerosis, and today I'm introducing a guest who's going to tell us about his experience. So welcome, guest. Please do tell us about your experience and how you've been getting on and what your hopes are for the future.
Hi to everybody. I was actually diagnosed with lichen sclerosis almost 3 years ago. It all started with very stinging, burning kind of pain that really dragged on for a few weeks. Then I said to myself, I'm usually very self-conscious on health, and a bit, everybody thinks I'm a bit hypochondriac, but anyways, I went straight to my GP and he had a look and he said LS after 3 seconds. I was referred to see a local dermatologist in Sydney, and we did a biopsy directly there, and yeah, it was actually LS. And I was usually, I was treated for the usual 3 months with very strong cortisone ointments, which is the traditional face shot approach with LS as an outer skin condition on the tip of the genitalia, which is the most classic location hitting male patients. That went all very well. The pain actually after 3 days went away with diaprazone, using it twice a day. After the 3 months treatment, I came back to follow up with my local dermatologist, was all good. But going back home after just 10 days, kind of a very strong discomfort pain hit me again. But having a look on the outer side when I was at home, it all looked good. So I went back to my local dermatologist and she said, it looks fantastic, we did a great job. Then she took a break and she said, there is a remote, but bloody remote risk factor there that maybe it just knocked the door and went inside. And I think that's what happened. And actually, that is what happened. And that's how it all started, really. And in terms of pain, this is for all real men that are actually experiencing LS while it gets in, as in pain level, it's just out of this world if it actually gets in.
So you're describing pain down inside the urethral opening.
Yeah,
Yeah.
if it is outside and if it's in great presence like I had, it is painful with a normal amount of opioids, even though I must say my case is a real, it's a big, it was a big potent attack of LS. So even when it was outside, was quite, I was actually on quite a big dose of opioids to deal with it.
So how does this affect the way you feel about yourself as a man?
Um, it's tricky. You get, I mean, at the beginning, because it's so painful, I would say at the beginning, you don't really think about it. You just focus on the pain. So you struggle in finding way of managing the pain and living with the pain. Because if it's on my level, it's very painful.
And where are you now? What sort of a doctor are you seeing, and what sort of treatments are you being offered, or do you think you'd like to
I
try?
think if we refer to purely LS affecting the skin on a dermatological perspective, I think we are quite well off here at least. But even Googling worldwide, I think there's a good awareness even for dermatologists to follow up and check on men about it. And I think it's very quick, the treatment, etc. But because when it becomes an internal factor and you do need a very complex, extremely well trained urologist that can deliver a big reconstruction of the genital, then it's another story.
And have you been able to find that sort of doctor in your location?
That it took me a while. Really, at the beginning, the thing is this, because the pain was so intense, it could have been other things. It could have been kidney stones. It could have been enlarged prostate. It could have been other things inside. I was just concerned really with the pain. So I went to my GP, referred to a urologist, um, but after the first cystoscopy, there were other issues really because pretty much there's only three surgeons, urologist, reconstruction surgeon that can perform this procedure in Sydney only, which is not a small city. So it tells you a bit that's even difficult to find the proper one.
Okay. Have you considered trying any other forms of treatment like PRP or stem cell, something like that? Does that appeal to you at all?
Um, Now, because I mean, in my case, we had to do a so-called two-stage reconstruction, and that will actually that includes having the genital completely open to air in half, and with the buccal mucosa open. So the real issue with many patients like me that had to go through a first open to air reconstruction due to LS damage, it's the issue of treating LS as a skin condition and trying to reduce the risk of comebacks, of recurrence. It's very important. That's when the PRP and the Dr. Casabona PRP treatment becomes something that is absolutely very interesting because if I were to go on with a second stage urotoplasty, which is the closing and of the genital as for a natural position, that will actually include risks that if the treatment is successful, these risks are reduced. Comebacks and recurrence, if they're not drastically reduced, at least the lifespan without recurrence can be much longer. So let's say if I do the PRP with Casabona and Genova, the treatment is really successful. I could stay 20 plus years without recurrence of LS rather than 15 years without recurrence of LS. Because traditionally, you see it everywhere. If a lot of patients that did second stage reconstruction, having suffering from LS, the issue there is they know that there is the risk of LS coming back. And because in the first place, LS was able to get in and provoke a lot of urethral stricture distance inside the urethra, and they needed to do an open to air. Comebacks, chronic comebacks of a condition like LS can actually be more aggressive. So substituting the urethral tube with buccal mucosa graft, being circumcised, being having performed a proper 1-2 stage urethroplasty is just not enough for the risk of LS coming back and getting inside again and doing a double reconstruction and extract more buccal mucosa graft from the mouth. It's just really so this is why the PRP is a very important factor in this game.
Okay, thank you. So, will you allow us to come back and interview you again in a few months and see how
Absolutely.
that would be wonderful. I think we've closed the interview now, and thank you very much for taking part. Is there any one final message you would give to the men out there who may be listening to your story? Do you have some advice for them?
Um, it's the thing is this. I would say that a lot depends at what stage in a man life's LS hits you. I know a lot of younger male patients that are kind of dealing with because really it does affect you a lot. It's not just being able to properly perform intercourse without discomfort and pain. It's just I would be very aware and treat it straight away. And because pain-wise, it's not worthwhile going on opioids and dealing with LS. And if you leave it not untreated for a while, it can actually drag on, burn more of the pain, and there's the risk that actually, like in my case, it gets in. Even though in my case it just got in after, I would say, no more than 3 weeks.
Okay, well, thank you again very much, and we'll look forward to catching up
Thank
with
you for
you
your
again
time.
in a few months' time. Thank you.
Cheers. Fantastic.